Hi everyone, welcome back to my channel and to Vlogmas Day 8. In today's video, we'll be diving into something super important. For all my fellow nurses out there, NHS bank job interview questions and answers for registered nurses. Whether you're preparing for your first NHS bank interview or looking to brush up your skills, I'll be sharing key questions, insightful tips, and perfect answers to help you land that job. So, grab a notepad and let's get started. 1. Can you tell us about your nursing experience and why you want to work for the NHS bank? My nursing experience spans several years in a variety of clinical settings, including acute care, outpatient services, and community health. I have honed my skills in patient assessment, medication administration, and collaborative teamwork, always ensuring that the care I provide is patient-centered and evidence-based. My roles have allowed me to work with diverse patient populations, managing chronic illnesses, acute conditions, and providing education to patients and families. I am particularly drawn to the NHS bank because it offers flexibility and the opportunity to work across different departments and trusts, allowing me to broaden my skills and experiences while supporting the organization in maintaining high-quality patient care during staff shortages. Being part of an institution that upholds the values of inclusivity, excellence, and compassionate care resonates deeply with my professional ethos. Additionally, I am excited about contributing to the NHS's mission to provide equitable health care and being a part of a team that continually strives for excellence. 2. How do you prioritize tasks during a busy shift? During a busy shift, I prioritize tasks by first identifying the most urgent needs. For example, I address patients with critical or life-threatening conditions immediately, ensuring their safety comes first. I also consider time-sensitive treatments, like medication administration, and ensure these are completed on schedule. To stay organized, I keep a checklist of tasks and adjust it as the shift progresses, being flexible to handle unexpected situations. Communication is key. I regularly update my colleagues and collaborate to share responsibilities effectively. This ensures that all patients receive timely and appropriate care, even during high-pressure times. My goal is always to maintain a calm, focused mindset and deliver the best possible outcomes for patients. 3. Describe a time when you dealt with a difficult patient or family member. How did you handle it? In my previous role as a registered nurse, I had a patient who was experiencing severe post-surgical pain. The patient's family was understandably concerned and felt their loved one was not receiving adequate care. They became visibly upset and demanded to speak with a senior staff member. To address the situation, I remained calm and empathetic, acknowledging their concerns and affirming their feelings. I explained the steps we were taking to manage the patient's pain, including adjusting the pain management plan in consultation with the doctor. I also assured them that their feedback was essential for improving care, and offered to arrange a meeting with the attending physician to further discuss their concerns. By maintaining open communication, actively listening, and taking swift action to address the issue, the family's anxiety was alleviated. They expressed gratitude for the transparency and proactive approach, and the patient's condition stabilized shortly thereafter. This experience reinforced the importance of empathy and effective communication in building trust with patients and families during stressful situations. 4. How do you ensure patient confidentiality and data protection in your practice? Ensuring patient confidentiality and data protection is a fundamental aspect of my practice as a registered nurse. I strictly adhere to NHS guidelines and the Data Protection Act 2018, ensuring compliance with GDPR to safeguard sensitive patient information. In my daily work, I handle patient records with utmost care, ensuring that physical records are securely stored in locked areas and accessible only to authorized personnel. Similarly, electronic records are accessed only through secure, password-protected systems. I maintain a high standard of confidentiality during patient interactions, ensuring that conversations about their care take place in private and appropriate settings. I avoid discussing patient details in public or unsecured environments to uphold their trust. Information is shared on a need-to-know basis, limited to those directly involved in the patient's care. When necessary, I ensure proper consent is obtained before disclosing any information. In addition, I continuously update my knowledge on data protection and confidentiality through mandatory training sessions. This helps me stay informed about evolving regulations and best practices. I also use secure, NHS-approved systems and devices for accessing and documenting patient data, ensuring the use of encrypted communication channels and avoiding personal devices for professional tasks. For instance, in a recent situation that required collaboration across departments, I ensured all communication about the patient was conducted through secure NHS platforms. I also verified the identity and authorization of every individual involved in the information exchange to maintain the highest level of data security. These practices reflect my commitment to protecting patient confidentiality and fostering trust in the care environment. 5. What steps do you take to stay updated with the latest nursing practices and guidelines? To stay updated with the latest nursing practices and guidelines, I take several proactive steps to ensure my knowledge and skills remain current. First, I regularly attend professional development courses and training sessions offered by the NHS and other reputable organizations. These courses are often aligned with updated guidelines and help me stay informed about new advancements in nursing care. Second, I actively engage with evidence-based resources, such as NICE National Institute for Health and Care Excellence, guidelines, clinical journals, and trusted nursing publications like the British Journal of Nursing. These provide insights into best practices and emerging trends in patient care. Additionally, I participate in peer discussions and team meetings where updated policies, procedures, and case studies are reviewed. This collaborative approach ensures I'm aware of changes and can learn from others' experiences. I also make use of online platforms like the NHS e-learning portal and RCN Royal College of Nursing webinars and resources. These provide convenient access to the latest information, particularly about clinical guidelines, infection control, and patient safety. Finally, I remain reflective in my practice by seeking feedback from colleagues and supervisors. This helps me identify areas for growth and tailor my learning to improve patient care outcomes. By combining formal education, evidence-based research, peer collaboration, and reflective practice, I ensure that my nursing care remains safe, effective, and in line with the most current standards. 6. Can you give an example of a time when you worked as part of a multidisciplinary team? An example of when I worked as part of a multidisciplinary team was during my time on a medical surgical ward, where we were managing a post-operative patient with complex needs. The patient had undergone major abdominal surgery and required input from various healthcare professionals to ensure their recovery. As part of the multidisciplinary team, I collaborated with surgeons, physiotherapists, dietitians, and social workers. My role as a registered nurse involved coordinating care, ensuring the patient's pain management was effective, and monitoring their vital signs for any signs of complications. I worked closely with the physiotherapist to encourage the patient to mobilize safely, assisting them with their exercises and ensuring they adhered to the plan for improved recovery. Additionally, I liaised with the dietitian to ensure the patient was receiving adequate nutrition, taking into account their dietary restrictions and healing needs. Clear communication was essential during this process, especially during handovers and team meetings, where I shared updates on the patient's progress and voiced any concerns. The collaborative approach ensured that the patient received holistic care tailored to their specific needs, ultimately leading to a smooth recovery and discharge with appropriate community support in place. This experience demonstrated the importance of teamwork, effective communication, and a patient-centered approach in achieving positive outcomes, and it reinforced my ability to contribute meaningfully as part of a multidisciplinary team. 7. How do you handle emergency situations or unexpected changes during your shift? In emergency situations or when unexpected changes occur during my shift, I prioritize remaining calm and focused to ensure patient safety and effective care. I follow a structured approach. First, I assess the situation quickly and gather as much relevant information as possible. For example, if a patient's condition suddenly deteriorates, I would immediately check their vital signs, identify potential causes, and escalate the issue to the appropriate senior staff or medical team. Simultaneously, I initiate any urgent interventions within my scope of practice, such as providing oxygen, repositioning the patient, or preparing emergency equipment. Second, I communicate effectively with the multidisciplinary team, ensuring everyone involved is informed of the situation. For instance, I would use tools like sparse situation, background, assessment, recommendation to provide a concise and accurate handover when escalating a situation. In scenarios involving sudden changes, such as a shift in patient assignments or unforeseen staff shortages, I adapt by reprioritizing my tasks to focus on the most critical needs. I ensure patient care is not compromised by coordinating with colleagues and delegating responsibilities where necessary. The outcome of handling emergencies this way has been positive, as it ensures patient safety while maintaining a calm and professional environment. My ability to act decisively and communicate clearly has been acknowledged by colleagues, and I feel a sense of accomplishment knowing I've contributed to providing excellent care under challenging circumstances. 8. What strategies do you use to manage stress and maintain resilience in a high-pressure environment? To manage stress and maintain resilience in a high-pressure environment, I use a combination of proactive strategies to ensure that I remain focused and effective while delivering high-quality care. Firstly, I prioritize time management by organizing tasks, setting clear priorities, and ensuring I allocate sufficient time for patient care and documentation. This helps prevent feelings of being overwhelmed, especially during busy shifts. I also practice mindfulness techniques, such as deep breathing exercises and brief moments of reflection during breaks, to stay grounded and calm amidst challenging situations. Secondly, I maintain open communication with my colleagues. I believe in sharing concerns or seeking advice when necessary, as teamwork is essential in reducing individual stress and ensuring smooth operations in a healthcare setting. Having a strong support system among colleagues contributes significantly to resilience. In addition, I place a strong emphasis on self-care outside of work. This includes getting adequate rest, maintaining a balanced diet, and engaging in physical activities such as walking or yoga to release tension and recharge. I also make time for hobbies and spending quality time with family and friends to maintain a positive work-life balance. Finally, I reflect on my experiences, identifying lessons learned and celebrating small successes, which helps me maintain perspective and stay motivated. By implementing these strategies consistently, I am able to manage stress effectively and remain resilient while providing the best possible care to my patients. 9. Why is infection prevention and control important, and how do you implement it in your daily practice? Infection prevention and control are critical in healthcare settings because they protect patients, staff, and the wider community from the risk of infections. As a registered nurse, maintaining strict infection control practices ensures the safety of vulnerable individuals, prevents the spread of healthcare-associated infections highs, and upholds the trust in the care environment. In my daily practice, I implement infection prevention and control by strictly adhering to established guidelines and protocols. This includes proper hand hygiene, such as washing hands with soap and water, or using alcohol hand rubs at key moments during patient care. I ensure the correct use of personal protective equipment (PPE), such as gloves, aprons, and masks, depending on the clinical situation. I follow the principles of aseptic technique when performing procedures, like dressing wounds or inserting catheters, ensuring that sterile fields are maintained at all times. I am diligent in ensuring that patient care environments are clean, and I collaborate with housekeeping staff to address any lapses in cleanliness. Additionally, I am vigilant about following waste disposal and sharps management protocols, segregating waste appropriately to minimize contamination risks. I also educate patients and their families about infection control practices, such as respiratory hygiene or proper wound care, to ensure continued safety beyond the clinical setting. By consistently implementing these measures, I contribute to reducing the risk of infection, ensuring a safer environment for everyone in my care. Infection control is not just a task. It is a fundamental responsibility embedded in my practice as a nurse. 10. How would you manage a medication error if one occurred? If I encountered a medication error, I would manage it promptly and professionally. Following the NHS guidelines and protocols to ensure patient safety remains the top priority. Firstly, I would immediately assess the patient to identify any adverse effects or complications resulting from the error. This includes monitoring vital signs and providing any necessary interventions to mitigate harm. For example, if the wrong dose of medication was administered, I would notify the appropriate team members, such as the prescribing physician or pharmacist, for advice on corrective action. Secondly, I would ensure that the incident is reported accurately and transparently. I would document the error in the patient's medical records, detailing what occurred, the immediate actions taken, and any patient outcomes. I would also complete a formal incident report through the hospital's incident reporting system, for example, DATIX, so the error can be reviewed and steps can be taken to prevent a recurrence. Communication is key in these situations. I would inform the patient or their family, if appropriate, about the error in an honest and empathetic manner, explaining the steps being taken to address it and ensuring them that their care remains a priority. Finally, I would reflect on the situation to identify contributing factors, whether it was a workload issue, a miscommunication, or a system error, and work with my team to improve practices. This might involve participating in a debrief, attending training, or suggesting process changes to prevent similar errors in the future. By addressing the situation promptly, reporting it transparently, and learning from the experience, I can ensure the best possible outcomes for the patient and contribute to a culture of safety within the NHS. Do you have any question? Thank you for the opportunity to discuss this role. I do have a few questions. First, could you share more about the team dynamic and the level of support available for nurses working in bank shifts? Since the nature of bank work often involves flexibility and covering various departments, I'd also like to know about the induction or orientation process for bank staff to help them adapt quickly to new settings. Lastly, how does the Trust support bank staff in accessing professional development opportunities, such as training or CPD continuing professional development sessions, to ensure we stay updated with the latest practices? That's it for today's video on NHS bank job interview questions and answers for registered nurses. I hope you found these tips and example answers helpful in preparing for your next interview. If you did, make sure to give this video a thumbs up, subscribe for more nursing content, and hit that notification bell so you don't miss a single day of Vlogmas. Let me know in the comments if you have any other interview questions you'd like me to cover. Thanks for watching and good luck on your interviews. See you tomorrow for day 9.